starts now. Health and Sexuality, a talk show that talks about education, orientation, and prevention for all ages. This show is produced by Fabiana Cavalieri and the consulting doctors Alfredo Romero and therapist Inês Cavalieri.
Good morning, Trianon listeners. I'm Sandra and I start Health and Sexuality. We have a very good program with lots of information for you. Dr. Alfredo Romero, another show starting. Dear listeners, another educational program about health and sexuality.
E quando o Dr. Ari fala em programa educativo, nós vamos falar com
Renato is 23.
de perdizes.
He has glossitis, an inflammatory tongue disease. Is it possible to be infected by any STD if I have oral sex in men and women? This is a very good question, because oral sex can transmit many infectious sexual DST. HPV is one of them. Could you imagine that HPV in your mouth is the cause of a cancer in your mouth, for example, or in your gums, or in your tongue, or in your throat? That's it. This kind of sexual can contaminate you if you don't wear a condom.
Leva a essa possibilidade de contaminação. E o futuro,
and it has been proved scientifically that it can cause serious disease like a cancer. So people have to think carefully before oral sex without a preservative. I'm talking to men and to women. The one that you can use as a preservative is a plastic film that you can cover the genitalia of your partner to do oral sex. You shouldn't practice this kind of sex in eventual partners. If you have been married for a long time, if you know she doesn't betray you, you don't betray her, so there is a certain safety. Absolute, there is none. Because think about carnival. Married people have sex with other people and then they drink a lot and they don't know what happened. So they may be contaminated. That is always the risk. No risk only for people that have been living together for a long time and are honest to each other, that they can rely on each other. But if the person takes drugs or drinks a lot of alcohol, sexual intercourse can happen at any time because they don't know, they are not aware of what they are doing. It's such a serious problem that Emilio Ribas, that is a serious source of research and is really reliable, and Instituto Chagas in the north also.
Instituto Evandro Chagas no norte, em Belém do Pará. Ou INPA na Amazônia.
Era INPA in Amazônia, in Manaus. They are institutions that have special places, emergency rooms for sexual problems. Imagine if you go out with an unknown person and then your condom broke while sexual intercourse.
A camisinha rompeu durante o ato sexual.
in the next 24 or 48 hours, you must go to this kind of ER, because in this place you prescribe the right medication for 30 days and you be examined before taking the prescription and 30 days after taking the prescription. In case something like this has happened to you, that you were contaminated, if you take this kind of care, you can avoid AIDS, you can avoid hepatitis B or C, that can be also sexually transmitted. So it's very important that you take this precaution. Having intercourse is very good for the human being. It's really beneficial for all the organs of a human being. But the exposure to possible contaminations is the reality. So, it's worth thinking it over, especially married people that have an affair, even though they've been married for a long time. You can put in risk your life and your partner's. Think carefully before you can contaminate your partner. It means exactly the same for men and women, because nowadays we don't have the same way of thinking from the beginning of the 20th century. We have this modern way of life where sex is taken freely, for men and women, for all social layers. It doesn't depend on their religion, on their beliefs, on their educational background, on the environment.
Independente da educação formal, independente de qualquer parâmetro, o sexo está ali.
Educate your children. Teach them about the risks of being sexually contaminated. It's not as it used to be. Only AIDS are going to kill you. No, one, HPV is a very serious virus, a very serious disease that can cause cancer in your mouth or your genitalia. Now, about Renato,
que nos fez a pergunta lá de perdizes. Renato,
you can be infected by one STD, not because you have glossitis, but because you don't take care of yourself. Yeah, it's really important, Renato. We know a case in our clinic, a young lady, a virgin lady, but she's HIV. She practiced oral sex with a person she didn't know, and she was contaminated. She couldn't rely on this person. She didn't know his historical background. Whenever you do it, take all the measures to avoid being contaminated. Wear a condom. It's really dangerous, even though. Take care. So our show every Sunday from 10 to 11.
Das 10 às 11 da manhã, esperando a sua ligação, o seu contato.
If you want to call us, 3831-3882.
Pela internet.
Or youtube.com. Health and Sexuality on the radio. You can send the suggestions, write us, and the doctors here will really help you.
Orientar da melhor maneira possível, ok?
Now Lucia from Brasilândia, who is 39 years old. I have numbness in my hands and dry mouth. How can I treat it? Dr. Ari. So, numbness in your hands and dry mouth. Many symptoms can be related to numbness. You can have carpal tunnel syndrome, because the nerve is pressured, diabetes. You didn't talk about your glucose level because people do suffer from numbness in their hands.
Devido às neuropatias causadas pela própria doença, a boca, inclusive a boca seca.
Thyroid problems can also cause dry mouth if you are overweight.
Obeso ou não, também tem propensões a dormências.
If you don't work out a lot, this kind of people have lots of numbness, especially when they are sleeping. Or if you suffer from a repetitive syndrome injury because you always work in the same position, hairdressers, people that work with computers. So there is a treatment, of course, but you have to talk to your doctor so he can give you the right diagnosis, examine, and then you have to see the reason why.
Causa de dormências nas mãos e a boca seca. Então, como nós falamos,
there are many diseases that can cause these symptoms.
Causam dormência nas mãos e boca
So it can be the same disease that are causing both or separate.
Ou coisas separadas.
But you should see a doctor. You have to see him to take the right treatment.
Para fazer o tratamento adequado, viu, dona Lúcia? Isso é coisa
You have to know what's happening.
Só descobrir a causa.
Dr. Alfredo.
We can't forget, especially women, don't drink a lot of liquid, and the dry mouth usually shows that women are not drinking a lot of liquid. We produce, during 24 hours, about 4 liters of saliva. Imagine, if this person doesn't drink water, not necessarily water, but liquid, juice, natural juice, of course, teas, milk, coffee, even rice beans, they contain water. But if you don't drink water, there will be a lack of moisture in your mouth. If you smell very yummy dish, you have that your mouth full of water. You can feel the saliva spilling because it's essential for your digestion. But if you don't drink water, don't drink liquids. Women usually do that. That's why they are constipated. They suffer from this kind of complaint of dry mouth. Or if you sleep with your open mouth, then it's a disaster. Because your tongue is hurt, your lips, your cheeks, because there is no moisture in your mouth. It's not lubricated. It's worth paying attention to these little details. I don't like water, doctor. Many women say that. But you have to deceive this lack of will to drink water. Drink milk, drink juice, natural juice. Oh, this juice can contain lettuce or vegetables. You can mix with fruit. You need 3 to 4 liters. What you drink with solid food and liquids. Thank you.
grande abraço para a senhora na Brasilândia.
Gente,
we'll be right back. We'll take a short break.